Hello, my name is Jackie Daniel and I'm the Chief Executive here at the University Hospitals of Morecambe Bay. I want to take a few moments today to respond to the Care Quality Commission re-inspection report. As many of you will know, the Trust was inspected in February 2014 and the Care Quality Commission found a number of issues and areas for concern. And as a result of that, the Trust was placed into special measures. It was rated inadequate. Over the last 18 months or so, the staff, we've all been working really hard right across the Trust to make the improvements that are required. After all, we want to make sure that our hospitals provide the very best care for patients. As you probably know, the CQC came back to re-inspect our hospitals in July this year. I'm delighted to see that the report published today recognises the hard work of all our staff, of our volunteers and our partners and the improvements that have been made. And in actual fact, it recognises improvements in all the areas that the Care Quality Commission raised with us. And Sir Mike Richards, the Chief Inspector of Hospitals, has made a recommendation to monitor that the Trust is taken out of special measures and he has raised our rating to requires improvement, which is really tremendous news. I'd like to take this opportunity to thank the public for sticking with us. Fortunately, we get a lot of positive feedback, but we don't always get it right, and I know that we've got more to do to improve. I'd like to thank our staff and the volunteers and our governors also for the work that they've put in over the last 18 months. They've worked really hard on the improvements and importantly making sure that the improvements we have made are sustained. And our two clinical commissioning groups and Monitor have also played their part in supporting the Trust and all our staff to make those improvements, so a huge thank you to them. But we must recognise that we've still got more to do. And I know that the staff do not feel complacent at all. Requires improvement simply isn't good enough. And I know that our staff have got an ambition to become a hospital that's rated as good and in time outstanding. And indeed that's what the patients across Morecambe Bay deserve. So I want to end by saying a huge thank you again to staff, to volunteers, to partners and governors for all the hard work that's taken us thus far in the journey. I know that staff will be relentless in their desire to improve things further, and I'm confident that we will do that.